All right, let's talk about healthy living, which always gets a little bit complicated when you're dealing with this on your screen. The fire is 90% contained, but there are still health concerns following the explosion at Smitty's. State officials and health experts are warning residents to stay alert, take steps to protect yourself from possible health risks. So Dr. Eric Griggs is with us now on set to talk about what those are. We're having a very interesting conversation, Doc. You're saying, you know what, I know some things that could go a little bit extra other than the regular exam at your doctor's office, but you want people to walk into their clinician's office today and say what? Their level of exposure?
Their level of exposure, and leave it up to your healthcare provider. Not suggesting, leave it up to your healthcare provider based on their evaluation on what test might or might not be need to be ordered. There's not a blanket test of blood work that needs to be ordered for everyone that walks in. It depends on your level of exposure, meaning when you're cleaning, were you a worker? Did you clean your animals? Did you actually breathe in some of the soot? And most importantly, what are your symptoms? Are you having nausea, vomiting, headaches, respiratory issues? Were you at risk? Are you immune compromised? Did you have lung issues prior to? Okay. And based on that, it's up to your healthcare provider. There'll be a battery of tests that they can order, should they deem it necessary, that can check for solvents or any of the byproducts that might be, and we don't know what this is. We have no idea. It's still being evaluated, so it's not really a time to like freak out, go to the doctor, hey, I want this blood, this. No, we just evaluate, keep your hands clean. The recommendation, I would recommend having a clean, dirty room in your house, a place where you take up all your dirty as you wash up and you clean, and then be very aware of your symptoms. Running your air conditioning in the house to continually sanitize the air and filter the air. But again, do the things that you can do, and then should you have symptoms or if you're concerned, go call your healthcare provider, make an appointment, and let them make the decision based on what you present them with.
So what to expect if they say, okay, you are a candidate that we would like to do further testing? What are those panels and tests?
So there are different panels that they do for urine. All these are different byproducts. We have no idea exactly what are out there, right? So there's urine tests. If you're having respiratory symptoms, there might be a chest X-ray, depending on how much further they need to evaluate. There might be a CT, a CAT scan. There are blood tests that can check your blood function for your liver panel, your kidneys, and your electrolytes, just to see how your body has it changed in metabolites. Are there any biomarkers for any of the metabolites of this chemical product that they can find? But again, this is further down the road.
Right.
And then should you present with any symptoms that look like they might be chronic, they'll be monitoring, long-term monitoring over it. But again, it's a dialogue with your healthcare provider about, this is my level of exposure, what else should I do?
So Tangipahoa Parish residents, there's a lot of people are farmers out there. A lot of people are working with well water, drinking well water as a source. What would you tell them when it comes to boiling their water right now? And no big request has come out to the public to do that at this point, but what would you recommend as a doctor?
I don't know the source of their water necessarily, but I don't think it's a bad idea to boil their water or to drink bottled water or use bottled water until we find out exactly what's going on and how safe things are. We know the booms are in the water. I mean, this is an environmental disaster. This is something that happens. Sometimes with small events, it can take up to 15 years to fully recover. But if you're growing food in the soil, if you're eating animals that eat the food and root in the soil, and you eat the animals, then it makes sense that it could be in your body. So again, it's an ongoing dialogue with your healthcare provider about moving forward. But with cleanup, wearing what we talked about before with anything, wearing your gloves, protecting yourself, wearing a mask, a clean, dirty room, and being really cognizant of your symptoms, especially if you have pre-existing conditions. Talk to your doctor about what else you should do.
All right, Dr. Griggs, we know that you're walking with us, so thank you for that. All right, culinary, let's talk about that.